How are we doing today, guys? It's Jesse with the Common Man, Corpus Christi, and here to bring you a little news. So, if some of you, if you listen to the Bob Jones show, I was on there this morning on Flanagan's Freedom Hour, talking about there was a Nueces County Medical Board teleconference, I guess is probably the best way to describe it, last Thursday night. And people were able to call in, ask questions about COVID and about the vaccines and about a whole bunch of different stuff like that. And Nueces County's medical experts would answer them for you. I was fortunate enough to actually get one of my questions answered. My question was, as a person who has tested positive for antibodies, because I have, why should I get the vaccine? And they went on to talk about the fact that they weren't sure how long natural immunity lasts, and that they knew the vaccines were safe and effective. So basically, they just reiterated the talking points of the CDC and Fauci and all the rest of the heads. They didn't give any actual information from themselves. So as always, to premise this, just so hopefully YouTube doesn't tear this video down, I'm not a doctor. I'm just reading the news, and I might give you a little bit of my opinion. But you should always talk to your doctor about these shots. And that's one of the other things that irritated me about this little conference that they had last Friday. So, but let's start at the beginning. So let's start with my question first. So I asked, why should I get the shot if I've already got antibodies? If I've already tested positive for antibodies. So they said something about the fact that that they didn't know the long-term effects of the antibodies, of natural immunity. So this right here was an interview from a Yale University epidemiologist, Dr. Harvey Rich, right? So this guy's from Yale, and this is what he was talking to Laura Ingraham, I believe. Yeah, Laura Ingraham on the Laura Ingraham show on Fox News, and was talking to her. So they go through over here, and so let's just start. Here's the transcript. We're going to go straight from the transcript because I don't want to misquote CNS News because, reasons. So Laura Ingraham asks, so if the vaccines are really the ticket back to normalcy, why is Singapore, where 83% of the population is fully vaxxed, in the midst of another COVID wave? Meanwhile, in Scandinavia, life is essentially back to normal. No mandates, vax passports, masks, everything's open, despite a much lower vaccination rate. Places like Denmark are averaging fewer than one COVID death a day. So what's going on? My next guest has some ideas. Dr. Harvey Rich, Yale epidemiologist, professor. All right, so Dr. Rich, what's going on? Well, Singapore has done very thorough at vaccinating its population, but the population has very little natural immunity. Hardly anybody got the infection in the first place. Now remember, this is Dr. Harvey Rich speaking, YouTube, not me. But population has very little natural immunity. Hardly anybody got the infection in the first place, and now the vaccines are wearing off. The vaccine immunity has a finite lifespan of somewhere between 3 and 6 months, and it's losing that over time, and the more people are getting infected again. So remember, this is Dr. Harvey Rich saying this. I'm just reporting the news and what he says. People can get infected while the vax is working fully, but they're relatively protected from severe outcomes, which is a good thing by and large for the people who take it. See, vaccine helps you from being super sick, according to Dr. Harvey Rich. But they really need much more natural immunity from the infection going forward, and in order to prevent what they're seeing. And they need that natural immunity to combat other viruses, other strands that may be coming as well. As for longer lasting protection, natural immunity is much longer lasting than vaxxed immunity. Okay? This isn't me saying this. This is Dr. Harvey Rich, a Harvard epidemiological professor, okay? This guy knows this stuff better than probably any of us watching this. Or any of you watching this, or especially me. Especially as me. I'm just the common man. I'm a normal guy trying to read information and interpret for myself. So, Ingram, you mean natural immunity that our own government claims isn't really protective at all? Okay, well, a big problem, Professor, Doctor, that Singapore now has its own mixed messaging from the leader. All right, cut back on, this is basically the lore. Lore hissing long. Cut back on social activities to slow the spread of the virus. Get vaccinated if you haven't already done so. Go for your booster shot when your turn comes. As more people are exposed to the virus and recover, our immunity levels will increase. COVID will spread less quickly among us. Okay, so two different things, Dr. Rich. This is from Ingram. So it seems that outside of Scandinavia, none of these leaders know what they're doing. I mean, they just simply don't realize the locking down prolonged the pandemic for most of these countries. That's Laura Ingram's opinion, not mine. She says, period. Rich, that's true, but he said it. He said as more people get the virus, more open up. More stuff opens up. I don't know, it says unintelligible. At the end, yeah, there, after he's flip-flopped early on, so that didn't happen exactly at the same time. But herd immunity is a real thing. Yes or no, Dr. Rich? Yes, absolutely. Natural immunity is a real thing in a large scale. We have about 70% now in the United States, and it's increasing over time. Absolutely. Okay, so this is a Harvard epidemiologist, specifically, I had it right. Yale professor, Professor Dr. Harvey Reich saying this. This guy right here is saying natural immunity lasts way longer and is going to be necessary. All right. Now, he still says the vaccines are effective, right? As always, talk to your doctor, find out what's right for you. But he says the vaccines are still effective from preventing major issues. Okay. So that right there is telling you that Nueces County's medical experts don't have any idea what they're talking about, or they're just reading from the CDC talking points and the Fauci talking points, right? So so now that we've gone through that, let me do something else for you real quick, going to the vaccines. All right, now this is from the Irish Times, okay? Waterford City District has the state's highest rate of COVID-19 infections. Okay, I'm not going to read this whole thing because there's only a couple of points that I think are really important. Country also has the highest rate of vaccination take-up in the Republic, okay? All of England. Waterford City has one of Ireland's highest rates of vaccination against COVID-19, but one of its electoral areas has emerged as the place with the highest rate of COVID-19 infection in the state. The city's South electoral area has a 14-day incident rate of 1,486 cases per 100,000 of the population. 3 times the national average, which stands at 493 infections per 100,000 people. So 3 times the national average. The adjacent electoral area of Tramore, Waterford City, has a 14-day rate of 1,121 per 100,000, according to the last as a 14. Wow, okay. To the latest figure published by the Health Services Health and Protection Surveillance Center. Waterford has the highest rate of vaccination in the country, with 99.7% of adults age over the 18, as registered in the last census, fully vaccinated. The country has gone from having one of the lowest rates of COVID-19 infection in Ireland to one of the highest. Okay, I don't know what that means. I'm not an epidemiologist, but you just heard from the Yale epidemiologist that said the vaccines wear off after 6 to 8 months. Now, obviously, if they are 99.7% infected or 99.7 vaccinated, why do they have the highest vaccination rate? I don't know. I'm just asking questions. That's all I'm trying to do. I'm trying to get some answers from people that are better knowledgeable about this. But when they blow smoke up my butt and give me really dumb answers that don't make any sense and counteract real world, real time data that we're looking at right now, how am I supposed to trust you? Right? How am I supposed to trust you? One of the other things that really irritated me, because one of the things that we always have to preface on YouTube is talk to your doctor, right? I literally was screaming at my phone during a lot of these answers and questions because they just flat out lied to these people. They were just giving misinformation after misinformation, or only giving half truths and not the whole story. Okay, there was a guy who called in and asked a question. He said, "My daughter is pregnant." Okay, her doctor, her personal physician, the one that you're supposed to ask, right? Her personal doctor told her she shouldn't get the shot. Okay, her personal doctor told her this, all right? Because she went to her personal doctor, like you should, and asked them questions, because your personal doctor knows your medical history better than anybody else out there. They can fairly assess you better than anyone else because they're your doctor. They know your situation. They know your history, okay? Guess what the Nueces County Medical Board said to do? They said, well, I don't know, because the dad asked, is this unusual? And they said, well, I don't know why they would say that. The FDA and the CDC are saying it's perfectly fine for pregnant women to get the shot. Well, you didn't even bother premising with, well, maybe she's got some kind of underlying medical condition that we don't know about, that maybe even applies to some of the FDA and CDC's rules and guidance about getting the vax. They didn't even preface any of that. They just said, well, the CDC and the FDA say it's fine for pregnant women to get, so she should go and get it. You're not her doctor. You're not her physician. You have no idea about her medical history. And that's what irritates me about these people going out and just pushing the shot over and over and over again on people. You don't know their medical history. You have no idea what could happen. We know in certain small percentages of cases, things happen. That's why you have to talk to your doctor. You have to go see your doctor for these kinds of things. All right? So, of course, they didn't even bring up. People asked about other issues as far as what you could do and things like that. They didn't bring any of that up. It was just everybody get the shot, everybody get the shot, everybody should get the shot. And there was so many sycophants for these damn COVID cult that we're dealing with. I was like 2 or 3 questions. When can I get my booster? When can I get my booster? When can I get my booster? When can I get my kids vaccinated? When can I get my kids vaccinated? Stop talking to these public figures and go see your doctor. Ask your doctor about this kind of stuff. Do not go asking these random ass medical professionals who know nothing about your medical history. You need to talk to your doctor about this. So one of the other things I wanted to bring up, but I didn't get a chance to, is I wanted to ask about early prevention and stuff like that. Things people could help to do. So this is from the Times of Israel. This was out on 17th of June. Mostly kind of flew under the radar. There was a few of us that talked about it, but most people didn't. This is just some information. I'm not a doctor. I'm not telling you what to do. Just some friendly food for thought. Okay? Right here, and this was back in June, right? 1 in 4 COVID patients hospitalized while vitamin D deficient die. Israel study. Among those without deficiency who are hospitalized, only 3% die. Patients with insufficient D are also 14 times likelier to end up in severe or critical condition, research shows. Okay? This right here kind of backs up the idea of what we've been talking about with seasonality and vitamin D. Because during the summer, those of us here in the South, we go inside because it's super hot outside. So we're not getting our vitamin D. We're stuck all among the same air. We're all breathing the same air. We're mixing all this stuff around because we're all trapped inside because it's freaking hot outside. And so we all know it's easier to spread the virus inside, right? We've pretty much known that from the beginning. So that's what happens. That's why we got a summer wave. And then now it's starting to get cold up in the north. So everybody's running inside. Boom. Here you go. Vitamin D deficiency. Okay? So I'm not a doctor. I'm not telling you to take extra vitamin D. That's something you got to talk to your doctor about, because if you do take too much of it, it can cause you issues. You got to talk to your doctor about how much you can take if you want to take it. It's completely up to you. I'm just saying this study out of Israel shows vitamin D deficiency was a huge factor in whether or not you died and how bad you got COVID. So this right here is a study conducted in the Galilee Hospital. 26% of vitamin D deficient coronavirus patients died. While among other patients, that figure was at 3%. Okay? This is a very, very significant discrepancy, which represents a big clue that starting with the disease with a very low vitamin D leads to increased mortality and more severity. Dr. Arman Bashkin, endocrinologist and part of the research team, told the Times of Israel. Okay? So there you go. Take that as you will and what you want. So this is one other thing I want to bring up before I leave you guys. This is an NPR article. And this is one of the things that why we talked about why we were worried about lockdowns. And I think this kind of adds a little bit of evidence to it. I don't think they're going to specifically come out and say that. But this is also happening in the United Kingdom as well. Over in England, they're having issues with their hospitals. Like 90% of the patients that are in their ICUs don't even have COVID right now. They're coming in for a lot of other issues. ERs are now swamped with seriously ill patients, but many don't even have COVID. From NPR on October 26, 2021. All right, we'll just run down and highlight some of this stuff real quick. Inside the emergency department at Sparrow Hospital in Lansing, Michigan, staff members are struggling to care for patients who are showing up much sicker than they've ever seen. Tiffany Dusong, the emergency room's nursing director, practically vibrates with pent-up anxiety looking at all the patients lying in a long line of stretchers pushed up against the baize walls of the hospital hallways. It's hard to watch, she says in her warm Texas twang. Hey, she's one of us. But there's nothing she can do. The ER's 72 rooms are already filled. I always feel very, very bad when I walk down the hallway and see the people in pain or needing to sleep or needing quiet. But they have to be in the hallway with you, or a hallway with, as you can see, 10 or 15 people walking by every minute. It's a stark contrast to where this emergency department and thousands others were at the start of the coronavirus pandemic. Except for the initial hotspots like New York City, many ERs across the U.S. were often eerily empty in the spring of 2020. Terrified contracting COVID-19, people were sick with other things and did their best to stay away from the hospitals. Visits to emergency departments dropped to half their normal levels, according to the Epic Health Research Network, and it didn't fully rebound until the summer of 2021. But now they're too full. Even in the parts of the country where COVID-19 isn't overwhelming the health system, which is pretty much everywhere, patients are showing up to the ER sicker than they were before the pandemic. Their disease more advanced and in need of more complicated care. See, this is one of the things we were warning about when y'all wanted to lock everything down. These people weren't going to go to the hospital. They weren't going to get the necessary checkups they needed. They weren't going to see their doctor for like advanced heart screenings and advanced cancer screenings and all that other kind of stuff. And this stuff was going to end up coming and biting us in the butt later. Now look where we are. Months of treatment delays have exacerbated chronic conditions and worsened symptoms. Doctors and nurses say the severity of illnesses range widely and include abdominal pain, respiratory problems, blood clots, heart conditions, and suicide attempts, among others. Hey, remember about those spikes in LA and the suicide numbers? But suicides and drug overdoses. Sorry, let me make sure I add that in. But there's nowhere to put them all. Emergency departments are ideally meant to be brief ports in the storm, which patients stay in just long enough to be sent home with instructions to follow up with their primary care physician. All right, upstairs, a mix of COVID and non-COVID patients, but warehouse for long hours. As Sparrow says, commenting the space is a valuable commodity. There's no privacy. We could have done the physical in the parking lot, he adds, managing to laugh. At least somebody's got a good attitude about it. It's a lot, Dusang says, watching emergency medical service teams. It's the highest I've ever seen in my career. About 3 times a week, the ER arrives at the point where it just can't take any more impatience. Dusang says it feels like waving the white flag, but you have to do it when it feels unsafe. So even if you arrive by an ambulance, there's no guarantee. So what is it? Lockdowns don't save lives, but they do kill. I don't know about that. If that's for sure, we won't know for years until after all the data and studies really come out. But this is something we were worried about when all the lockdowns happened. These people waited to go to the doctor, they waited to go to the emergency room, and now they're worse than ever. And that is solely on the heads of the people that pushed for these lockdowns. That's solely on the heads of them. So that's my little update as to what's been going on. If you guys didn't catch the Bob Jones show this morning, I highly recommend it, especially Flanagan Freedom Hour every Thursday at 8 o'clock. I love to catch the show. That's Woohoo's little section I was on this week. I've been on there before. Those guys are great. So I highly recommend going over to Keys and checking out their website and checking out the podcast and getting that. So this is just, I want to go over this and let you guys know about the phone call I was part of last week. If I can find the audio for it anywhere online, I'll let you guys know, link it to you, send it out, put it on the Common Man pages. But I think that's all I got tonight, guys. I've been long-winded enough. So once again, talk to your doctor. Do not listen to these medical experts in the government. Go talk to your own personal doctor. Find out what's right for you, whether it's the shot or the vitamin D or whatever it is. Go talk to your doctor. Thanks, guys. This is Jesse with the Common Man, Corpus Christi.